Angelica Sinitsky, Spurb.
Hello, and welcome to episode 92. We're getting close to that episode 100 of Spurb's Herbs. Today, we are going to be talking about an interesting Ayurvedic herb. And again, I'm not sure about pronunciation on this stuff, so please bear with me if I'm totally butchering it. But I believe it's Vasaka, or it could be Vasaka. I'm not sure. And this is an interesting one because I actually had it as a completely different species, but as I studied it, the actual species is Justicia adhatoda. I think I had it adhatoda as the genus name, and there was a different species name, which is a valid synonym, but it seems like the most correct species name for this herb is Justicia adhatoda. And it's also commonly known as malabar nut. So without further ado, I am, as always, your presenter, Dr. Greg Sperber. Let's get into it. Today's episode will be looking at another herb of the world, Vasaka of Justicia adhatoda, or malabar nut. This is a relatively well-known Ayurvedic herb used for over 2,000 years and is used primarily for respiratory complaints, though different preparations are used for other applications. Before we go too far, I want to go back to this 2,000 years thing, because a lot of herbs say that have been used for thousands of years, and they very well may be, and they've found some evidence of them being used thousands of years ago. This one, there were just a lot of quotes saying this is over 2,000 years old, but nothing specific. So please take that 2,000 years as with a little bit of grain of salt, which we should always do once we get past about 1,000 or 1,500 years. But as always, we will do our deep dive into this herb and look at its traditional uses and its preparation, interactions, and cautions, and see if the science supports its use. And as usual, we'll be adding something a little different. We are going to look at the similarities and differences between Ayurvedic and Chinese herbal medicine. I found an amazing article that I'm going to summarize for you about the differences between those, because we'll get into it. It's fascinating. It's going to be another fascinating submarine journey into the dark depths of herbs. Please join us for this adventure. Before we get into this, I want to tell you about a deal we're doing. We are starting an amazing deal for our courses. If you use them for continuing education, professional development, or just for your own edification, we are offering 50 hours of courses for an unbelievable price. Normally, this would cost $750. However, with the special code 50 CEUs, this is going to be only $325, or only $6.50 per hour. Plus, and here's a big plus, you can get a free signed copy of one of my books. Just pay for shipping and handling. There's a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist, for free. So that is an amazing deal. I've never done a deal this good. So if you have any of your relicensing or rediplomating coming up, this is an amazing deal. Or if you just want to have an amazing deal on some great courses, check it out. Just go to the webpage, www.integrativemedicinecouncil. That's Integrative Medicine Council, council.org/CEUs1, the number 1, for this amazing deal. Step you through the process of getting all that good stuff for a great deal and the free books. So that would be awesome. And I think this is an amazing deal. If I am up for my CEUs coming up in 6 months, unfortunately, I can't give them to myself. So otherwise, I'd be doing this deal in a heartbeat. So hopefully see you there. So www.integrativemedicinecouncil.org/CEUs1, CEUS1. So let's talk about a little something different. Often I figure out what each episode is a little something different, after I'm done with developing the rest of the episode. Sometimes I know what I'm going to do before, but most often I kind of develop an episode and then go, okay, what am I going to do for a little something different? Often, like today, I will find something that I think will be awesome for a little something different as I'm researching the episode, which is why I kind of do it that way. Going back a long time, over 35 years now, my martial arts instructor would say that many aspects of Chinese martial arts and possibly medical arts stem from or are derivations from Indian and Ayurvedic thought. So he would say that the Ayurvedic or the Indian side, they were very good at figuring this stuff out. And then the Chinese were very methodical. So they'd add very specific methodologies to things. And together it came out with something really amazing. So when I stumbled on an excellent article entitled Ayurvedic Herbal Medicine and its relation to Chinese herbal medicine, it was a perfect fit for today's episode as we're talking about an Ayurvedic herb. Couple that with it was written by Subhuti Dharmananda, a very distinguished author whose articles always show a deep understanding of Chinese medicine. And with a background in Ayurvedic medicine, it is going to be a very interesting discussion. While this little something different is based on this article from Dr. Dharmananda, I encourage you all to read it for yourself as it is a long and deep read, which I don't think I can do complete justice to. You can see where to get it if you're online. You can of course just look it up. But I have it if you have the notes. It's in the bibliography. It's a fantastic. You want to look for Dharmananda and put in Ayurvedic and Chinese herbal medicine. He has a ton of articles. I gotta say, I don't know how he's written so many great articles, and I just every time I come across one of his articles, I learn something, which is not easy to do with a lot of the articles that are out there. So I love his articles in general. I think I met him once, but kind of before I knew that he had done so many great things. So I don't think I appreciated it when I met him, but it's just fantastic articles. So this is a great article. So there's going to be a lot of quotes from the article, and then I'm going to throw in some of my own thoughts as we go along. So Ayurveda is often translated as, quote, the science of life, unquote. However, Dr. Dharmananda suggests it is less science and more religious, saying Ayurveda is an instruction for enhancing life rather than science for enhancing life. I think that's really interesting. Kind of gets into the philosophy. And he's, as we're about to say, he says this is very similar to Chinese medicine as well, which I think is an interesting thing. And I don't think we should, we know that Chinese medicine works, those of us who use it a lot, but it also, the science is getting there, but it isn't fully behind it either. So it's kind of an interesting thing to say. He compares this to Chinese medicine, saying Ayurvedic medicine has some relevance to Chinese traditional medicine. Both systems are instructional rather than scientific and are fundamentally aimed at enhancing life. Both are additionally focused at treatment of specific diseases that plagued ancient societies for centuries. Nearly half of the most commonly used herbs in each of these two Asian medical systems, India and China, are the same or similar, and their actions are described in somewhat overlapping terms. For example, in both systems, herbs are described according to the symptoms they treat, their warming or cooling nature, and their influence on the body humors. What differs is the basic set of categories of disharmony, the diagnostic and therapeutic groupings. In traditional Chinese medicine, the correspondence systems of yin and yang and the five elements have a strong influence, as do the depictions of certain bodily humors, qi, blood, moisture, and essence. He says moisture, we usually translate that as fluids and essence, and the internal organ systems, or the zang fu. In Ayurvedic medicine, although the total system is quite complex, there is a dominance of the three dosha, also known as the tridosha system, Kapha, Pitta, Vata, also called Vayu. These three function within a body that is described primarily in terms of stages of transformation, following the path of ingested food as it is converted into essential substances that comprise the body, rather than by physical structures and functional organs. This is where I just want to continue to quote the article because it's so well done. I'm going to indulge the search a little longer. I had to interject there and kind of put my own spin on things a little bit before I just quoted indefinitely. The reliance on a triad of influences on health and disease sometimes forces Ayurvedic medicine into a relatively simplistic system, which has had the effect of strangling its development compared to Chinese medicine. The enforced alignment with so-called cosmological speculations was a problem that also affected Chinese medicine, where the five element and six qi environmental influences systems, we call it six qi or six pathogenic factors or pathogenic qi systems, had a stifling effect because everything was forced to fit, even when reason and experience indicated otherwise. I like that he's bringing this up because this is true. I mean, I still remember, I got my first teachings of Chinese medicine from my martial arts instructor, and he said, okay, look, you look at something like the stomach and the spleen being the digestive organ, those make sense as yin and yang pairs. But when you start looking at like the heart and the small intestine, how the heck are those yin and yang pairs? And he was skeptical of it as well, even though he was very much into Chinese theory and Chinese medical theory as well. So I've always had a little bit of that kind of inculcated into me. Okay, so continuing with Dharmananda's article, Chinese medicine made an escape from its philosophical binds through constantly reworking of the basic system by strong-minded and experienced commentators. Ayurvedic medicine did not have a similar transformation, and so it struggles with certain inconsistencies that date back to a much earlier age without having been addressed, at least in any preserved writings in the interim. Ayurvedic, Chinese, and other traditional systems are today yielding their theoretical and experiential frameworks to investigation by modern scientific techniques, applied mainly for the purpose of illustrating the effectiveness of remedies that have been developed over the centuries. And I would say, in the absence of these theoretical sort of frameworks. In this context, the underlying theoretical framework fades away, and the tested substances become the focus of a new international effort at preventative healthcare and disease treatment. Herbal formulas developed today rely on a combination of traditional and modern indications for the use of the medicinal materials. Dharmananda then continues to discuss the original source books for herbs in the Chinese medical tradition, the Huangdi Neijing, or Yellow Emperor's Classic of Internal Medicine, written about 100 BCE, which he actually breaks down into its two components, the Su Wen, or basic questions, and the Ling Shu, or the there's different translations of this, the center pivot or something along those lines. And the Ayurvedic tradition, the Karaka Samhita, or Compendium of Karaka, and the Susruta Samhita, or Compendium of Susruta, both written about 100 CE. So those are about 200 years later. Together, the Chinese texts are about 600 pages in translation, while the Ayurvedic texts are 2,700 pages in translation. The Chinese Su Wen, again, this is a component of the Huangdi Neijing, Yellow Emperor's Classic of Internal Medicine. The Chinese Su Wen and Indian Karaka each present steps to take in one's daily life to promote health. They also describe causes of disease such as environmental, dietary, and emotional factors, present information about specific diseases and disease progression, and offer therapeutic measures. Whereas the Su Wen mainly recommends acupuncture as the therapy to be used for diseases, the Karaka mainly presents herbs, oil massages, and enemas. In that aspect, the Karaka is comparable to a different pair of Chinese books, the Shangheng Treatise on Diseases Caused by Cold Pathogens, and the Jingui Yao Wa, Miscellaneous Diseases and Their Treatment. So both of these were actually one book, and they were split up later on into two books. So this is still just, it's technically one book originally. And this was written about 200, actually it's often given 220 CE. So this would have been 100 or so years, 120 years after the Karaka. Those texts mainly present herbal therapies. Yes, when I talk about the Shangheng and the Jingui Yao Lua, I talk about them being the oldest existing books on herbal formulas. So these are really about herbs. The use of therapeutic massage with specific oils according to the disorder being treated, and heavy reliance on enemas, usually made with an oil base, is unique to the Ayurvedic system. Applications of oils internally and topically is often referred to in recent books as oleation. While the Lung and Jingui Liao Lua, originally a single book and later divided, are the earliest existing Chinese books on herbal formulas, there has been a long reliance on various materia medica texts throughout the centuries. Dharmananda says Ayurvedic medicine has not had as rich a tradition of materia medica works, with much reliance placed still on the contents of the Karaka. In 1908, so this is after centuries of a lot of development in Chinese, millennia, and a lot of development of Chinese medicine. In 1908, Dr. K.M. Nadkarnia published a 2-volume Indian Materia Medica, a guide to Ayurveda that is still considered the standard text. It combines information from ancient traditional practices, current Ayurvedic practices, and reports from Europeans, such as analysis of active constituents, pharmacology, and European uses of the same herbs. Unlike the Chinese Materia Medica books, this Indian text makes no references to previous works on Indian herbs, does not outline any history of the development of the drugs, does not indicate when an herb was introduced into practice, and except for occasional references to Karaka, doesn't quote earlier authors on Ayurvedic medicine, except for those working right around the time of its publication. The proper translation and understanding of the key element of the Ayurvedic tradition, the tridosha, remains at the heart of making Ayurveda accessible to those who did not grow up with and assiduously study this field. Well, Dharmananda adds a lot more context and correlations. He does a great job of discussing the similarities between these medicines in the following text. So long as one is, quote, so long as one is careful not to rigidly link Indian and Chinese traditional ideas, it is possible to make reasonable comparisons of the properties of herbs and their therapeutic actions. For example, rather than describing excess and deficiency conditions as done in the Chinese system, the Ayurvedic system tends to depict on one hand, excitation or disturbance, quote, vitiation, and on the other hand, what might be termed sluggishness of the doshas. Still, these imbalances correspond in practice with the Chinese excess and deficiency concepts. These linkages are roughly as follows. Kapha corresponds very roughly to the Chinese concepts of yin, moisture, and phlegm. That is, it has wet qualities and tends towards coldness and heaviness. Herbs that are classified in the Chinese system as moisturizing, several spleen qi tonics are described as having this property, yin nourishing, and cooling generally fit well with the concept of increasing kapha to counteract its relative deficiency. Herbs that are classified as drying, dispersing, and warming generally fit well with the concept of calming or decreasing kapha to counteract its excitation. Kapha excess corresponds with formation of swellings, abscesses, and cysts. Pitta corresponds fairly closely with the Chinese concepts of qi, especially stomach qi, and fire. That is, it has warming, supplementing, and dispersing qualities. Herbs that are classified in the Chinese system as tonifying qi, invigorating the stomach spleen system, and dispersing cold stagnation, spilling chill, aromatic moisture, resolving, etc., fit well with the concept of invigorating pitta. Herbs that are cooling, anti-inflammatory, and sedative fit well with the concept of calming pitta. Pitta excess corresponds with feverish conditions, hyperactivity, and inflammation. Vata corresponds somewhat with the Chinese concept of qi, especially meridian qi, lung qi, and kidney qi, yang, and internal wind. Herbs that tonify qi, promote qi circulation, invigorate yang, and improve nervous system functions correspond reasonably well with the Indian concept of invigorating vata. Herbs that calm internal wind and have sedative function fit well with the concept of calming vata. However, there is a particular distinction between the Chinese and Indian concepts. In the Chinese system, promoting qi and enhancing internal wind are usually associated with increasing heat. By contrast, in the Indian system, vata is associated with cold, so increasing vata is attained in part by cooling rather than heating. This diametric opposition in a fundamental area of description, cold versus hot, leads to obvious differences in the way some herbs common to both traditions are used. Overall, Pitta and Vata are especially distinguished in the Indian system by the hot versus cold properties. Vata and Kapha are distinguished in the Indian system primarily by the dry versus moist properties. Okay, well, the article continues. We will continue with today's Ayurvedic herb. That herb is Justicia adhatoda or Vasaka. As many as we're going to find, there's a lot of other names for this as well. It's in the family Acanthaceae, Acanthaceae, Acanthaceae. Man, sometimes I wish I took Latin. I have a friend who did Latin. Species. So as I said, the species is Justicia adhatoda L. Remember, the L stands for the biologist who first classified it. In this case, just the simple L means Linnaeus, who's the first one who kind of established the system, the binomial system that we use today for classification. But there are lots of synonyms, including Adhatoda serrata Raff, Adhatoda pubescens Moinch, Adhatoda Vasaka Knees. That was the one that I was originally using for this herb. As I said, I think Justicia adhatoda is more correct, though still see that a lot. Adhatoda Vasaka Knees, Adhatoda zelanica medic, Dianthera latifolia salazb, Ecbolium adhatoda, L in parentheses Kunze. Again, those are biologists. And Genderusa adhatoda L in parentheses stewed, Steud. So lots of different species, and I saw a lot of these in the literature. Like I said, Justicia adhatoda seems to be the most correct today, though I saw adhatoda vasica quite a bit, as well as several of these others. The medicinal part of this herb, many parts of the plant are used medicinally, including the leaves, roots, flowers, and bark. Other names for this, Vasaka is Sanskrit, Dosa is Hindi, also Dulsa, Aradusi, Arusha, Adathodai, Bakash, Bansa, Basic, Basudi, Becker, Bekkr. Again, please excuse some of my pronunciations here. Adalodacam, Adusoj, Adasaramu, Vasa, lion's muzzle, and stallion's tooth. I like those last two. Talk a little bit about that Acanthaceae family. There we go. I can finally pronounce it properly. The Acanthaceae, and then of course, Acanthaceae or Acanthus family consists of dicotyledonous flowering plants. And we're going to talk about that right now. The dicotyledons, there we go, also called dicots, refers to a plant having two embryonic leaves, or cotyledons. There are approximately 250 genera and 2,500 species. The family has simple, opposite, decussated, or crossing leaves with entire margins and no stipules. Stipules, remember, are little stems between the leaf and the actual stem. Many plants in this family are used medicinally and may be antiviral and fungal, anti-inflammatory, antipyretic, insecticidal, hepatoprotective, so it helps the liver, and antiplatelet aggregation. So lots of positive potentials from this family's various plants in this family. History. The history is interesting about this herb in that it has been very difficult to find any. All of my sources, several books and several web searches and many articles say Justicia adhatoda has been used for thousands of years. And that seems to be the entirety of the history of this herb, at least as far as I can determine. I do not know why all these sources say it has been used for thousands of years. They all say it, and not one of them gave any justification for why they say it's been used for thousands of years. There was one article which had a little bit more than other sources about the history of this herb. Justicia adhatoda has long been part of traditional Ayurvedic, Indian, and Unani Arab European medicine, with its roots, leaves, flowers, and bark all used in various preparations to treat ailments ranging from coughs to asthma. During the 20th century, scientists began to recognize and study its usefulness, with Vasaka syrup and liquid extract appearing in the Indian Pharmacopoeia in 1955. 4 years later, an Indian research study outlined the bronchodilatory, or the opening of the bronchioles in the lungs, activity of the Justicia adhatoda alkaloid vasacinone, while the late 1950s also saw the development of bromhexine, a vasicine-derived drug to clear mucus from the respiratory tract by the pharmaceutical company Boehringer Ingelheim. So these are both derivatives, the vasicine and the vasacinone are both in this particular herb. Bromhexine, introduced to the market as bisolvon, came into medicinal use in 1966 and was followed in the late 1970s by ambroxol, a semi-synthetic bromhexine metabolite to treat respiratory diseases associated with viscid or excessive mucus. Now that the original patent has expired, generic ambroxol products are available from many companies, and ambroxol lozenges for the treatment of sore throats were introduced in 2002. Wikipedia, don't like using Wikipedia as a great source for all of these things, but sometimes it just has information you don't find elsewhere. So sometimes I throw it in there. So Wikipedia says adhatoda means untouched by goats in Tamil. The name derives from the fact that animals like goats do not eat this plant due to its extreme bitter taste. That's what I have for the history. Other uses, there does not appear to be major other uses for this herb, at least in the common literature. In other words, it's primarily, so one of the things that it's primarily medicinal, though there are some peoples who do use it as a food source or as one potential food source. So their food might be another use here other than just medicinally. Traditional uses, lots of potential traditional uses, lots of sources. Most sources referring to this herb start by saying it has been used for centuries or millennia for treating respiratory conditions, especially asthma and chronic bronchitis. Ayurvedic Herbs, the comprehensive resource for Ayurvedic healing solutions by Sodhi, we're going to mention his name a bit in this, says adhatoda vasica, a small evergreen shrub, has a multitude of uses in traditional Ayurveda and is best known for its effectiveness in treating respiratory conditions. The leaf buds of Vasaka are chewed, sometimes with ginger, by yogis or sadhus, and this has a stimulant effect on the respiratory system. So I got to be honest, I don't think I'd come across this word sadhus before, so I had to look it up. So a sadhu is a religious ascetic, mendicant, or any holy person in Hinduism and Jainism, Jainism, I haven't heard that word before, who has renounced the worldly life. So that's what an ascetic means. So that's a sadhu. So moving on, back to the quote, as an antispasmodic and an expectorant, Vasaka has been used for centuries with much success in treating asthma, chronic bronchitis, and other respiratory conditions. More recently, this herb has been studied for its potential in treating tuberculosis. All parts of adhatoda vasica have medicinal value. A powdered form of the herb, boiled in sesame oil, is used to heal ear infections and to arrest bleeding. Boiled leaves of Vasaka in the form of a poultice are used to treat rheumatic pain and to relieve the pain of urinary tract infections. Adhatoda Vasica, remember that's another name for this, Justicia adhatoda. Adhatoda Vasica also is believed to have abortifacient properties and is commonly used in some parts of India to stimulate uterine contractions, which speeds childbirth. So it can cause an abortifacient. It is abortifacient, and it also can be used in childbirth as well. This plant, too, is used to stem bleeding in conditions such as peptic ulcers, gingivitis, excessive menstrual bleeding, and hemorrhoids. Another book, Major Herbs of Ayurveda, by Williamson, or edited by Williamson, says adhatoda vasica has been most commonly used for the treatment of respiratory complaints and diseases such as coughs, colds, and asthma. The leaves are boiled and taken orally for fevers, and warmed leaves are applied externally for rheumatic pains and dislocation of joints. The powder boiled in sesame oil is used as a local application for ear infection and to stop bleeding. In Nepal, a dried water extract of leaves is used to relieve stomach acidity. And in Bihar and other parts of India, a decoction of the leaves is used to facilitate childbirth or induce abortion. A paste of the leaves is sometimes applied to the abdomen to treat urinary disorders. The leaves and flowers are cooked as a vegetable in the Khasi tribe in India. It has been used by European herbal practitioners as an antispasmodic, expectorant, and febrifuge. Febrifuge is a fever reducer. Dunkar, which had a review article, Dunkar and their team say similar things. All parts of the J. adhatoda has been used for their curative effects from ancient times. It has been used in Ayurvedic system of medicine for the treatment of various ailments of respiratory tract in both children and adults. Various parts of the plant are used in Indian traditional medicine for the treatment of asthma, joint pain. It says lumbar pain, but I think it means lumbar pain. That is a direct, this was not the best edited article. So that was, I should put a sick there, SIC, just to show that that was the original article. Sprains, cold, cough, eczema, malaria, rheumatism, swelling, and venereal diseases. J. adhatoda has also been used by European medical practitioners. The fluid extract and tincture were used in England as an antispasmodic, expectorant, and febrifuge. It was said to be beneficial in intermittent typhus fever and diphtheria. In Germany, the leaves are used as an expectorant and spasmolytic agent. In Sweden, J. adhatoda is classified as a natural remedy, and some preparations against cough containing an extract of Vasaka are accessible. Dankar and the team goes on to discuss the uses of various parts of the herb. The whole plant is used as an ingredient of numerous popular formulations, including cough syrup, used in combination with ginger, zingiber officinale, and tulsi, Ocimum sanctum. That's not an herb I'm familiar with, where it exerts its actions as an expectorant and antispasmodic. Plant is used for treatment of excessive phlegm and menorrhagia in Sri Lanka. Menorrhagia is basically bleeding outside of the menstrual, vaginal bleeding outside menstrual and in between. And no, it's excessive menstrual bleeding. I'll get it right eventually. It's also used for the treatment of bleeding piles, which is an old term for hemorrhoids, impotence, and sexual disorders. A yogic practice is to chew the leaf buds alone or with a little ginger root to clear the respiratory passages in preparation for the vigorous breathing exercises. Various preparation of leaves are used for curing bleeding, hemorrhage, skin diseases, wounds, headache, and leprosy in Southeast Asia. The bruised fresh leaves are used for snake bites in India and Sri Lanka. Usually yellow leaves are exploited for cough, and smoke from leaves is used for asthma. Plant leaves are used for checking postpartum hemorrhage and urinary trouble. The leaf powder boiled in sesame oil is used to stop bleeding, earaches, as well as pus from ears and jaundice. Decoction and ash of leaves are used for bronchial complaints such as asthma, tuberculosis, antipyretic, which means it reduces fevers, and relieve acidity. The leaves are toxic to all forms of lower life, that's a quote, and have insecticidal effects. It's also used for stomach catarrh with constipation, gout, urinary stone, and warm leaves used externally for rheumatic pains and dislocation of joints. This word catarrh is an old word that every time I read it, I can never quite remember exactly what it means. It's always, usually you hear about it with respiratory, like with, coughs with catarrh stuff. But catarrh is an inflammation of mucous membranes in one of the airways or cavities of the body, usually with reference to the throat and paranasal sinuses. In this case, we're talking about the stomach. Moreover, the preparation of leaves in spirit is used for curing the wealthy person suffering from certain humors in Myanmar. So that's the leaves. Let's go to the roots. The extract of roots of J. adhatoda is commonly used by rural population against diabetes, cough, and certain liver disorders. The paste, powder, and decoction of root is used for curing tuberculosis, diphtheria, malarial fever, leukorrhea, which is white discharge from the vagina, and eye diseases in Southeast Asia. The paste of roots mixed with sugar and used for treatment of acute nightfall in Siddhapur district, Uttar Pradesh, India. So I'd never heard this term nightfall before, so I had to look it up. So nightfall is the occurrence of spontaneous orgasm and ejaculation, usually during sleep. In medical terms, it's called nocturnal emission. I never heard it termed nightfall before. So there you go. Moreover, the macerated roots of J. adhatoda are applied on the pubic region and vagina to help parturition, and it facilitates the expulsion of fetus. The root decoction is also used for gonorrhea. Flowers. The fresh flowers are used for ophthalmia. Again, not a term that I'm super familiar with, but what it means is inflammation of the eye. Ophthalmia and various preparations of flowers are used for treatment of cold. Phthisis, I had to look up phthisis as well, which is basically a progressively wasting or consumptive disease condition, especially pulmonary tuberculosis. So it's another way. It's basically wasting disease. So that's thesis. Thesis. I had to look up how to pronounce it too. Asthma, bronchitis, cough, antispasmodic, fever, and gonorrhea in Southeast Asia. Flowers are also used as antiseptic to improve blood circulation and hectic heat of the blood. Finally, the fruit of J. adhatoda are used for curing cold, antispasmodic, bronchitis, jaundice, diarrhea, dysentery, fever, and as a laxative. Another review article by Chodhari and their team says folk uses include adhatoda vasica, commonly known as Vasaka or J. adhatoda, is the most important Ayurvedic herb, which is mainly used in respiratory diseases, including chronic bronchitis, whooping cough, and asthma for both children and adults. Glycodin, which is a significant product isolated from the leaves of adhatoda vasica, is used to cure bronchitis. Reported studies reveal that the leaves of the A. vasica plant are used to induce abortion by 70% of the pregnant women in Gora village of Lucknow. In Sri Lanka, it is used as a sedative expectorant to treat excessive phlegm, mucus with bacteria, the debris sloughed off inflammatory cells, and menorrhagia, a disorder of endometrial lining of the uterus. It acts as an antispasmodic and anthelmintic drug, so anti-worm drug, and is also used to treat diseases like bleeding piles, again, hemorrhoids, impotence, and sexual disorders. As the plant is a rich source of vitamin C, it possesses various therapeutic properties like anti-inflammatory, anti-bleeding, anti-jaundice, anti-diabetic, disinfectant. I don't know if I'd equate vitamin C with a lot of those potential therapeutic properties, but okay. Also, the plant has been used to treat cold, cough, pneumonia, fever, jaundice, whooping cough, catarrh, asthma, and whooping cough. Again, whooping cough. This is a quote. Okay. Traditionally, various parts of the plant are used to treat diseases like asthma, joint pain, sprains, lumbar pain, malaria, cold, cough, eczema, rheumatism, swelling, and venereal disease. In England, the fluid, this seems very similar to what we just read, fluid extracted from its leaves used as an antispasmodic, expectorant, and febrifuge, is also advantageous against typhus fever and diphtheria. Leaves of this plant are used as a spasmolytic agent as an expectorant in Germany. In Sweden, the extract of the adhatoda vasica plant is used to prepare medicine against cough. Various parts of the plant play a significant role to cure different diseases. Still on traditional uses, a lot of different uses, seeing a lot of the same things, but from slightly different sources and perspectives. WebMD, which I consider to be not a bad source on the web. So WebMD says malabar nut is used to loosen chest congestion, open the breathing tubes or bronchi, and treat spasms. It is used for upper airway infections, common colds, cough, asthma, and tuberculosis. So we're talking about traditional uses. So let's discuss the traditional Ayurvedic properties of this herb as described by Sodhi. And as I do, I want to remind us of what the properties mean. So the gunas describe 10 pairs of qualities used to describe medicinal and other substances. Justicia adhatoda is considered lagu or light and ruksha dry. The rasa or taste refers to the 6 tastes in Ayurvedic medicine. This herb is tikta or bitter and kashaya or astringent. The virya, which is spelled both Virya or Veerya, or energy, is the energy or potency of herbs and is considered heating or cooling. And J adhatoda is shita or cold. Again, excuse my pronunciations. The vipaka or post-digestive effects relate to, quote, relate to processes of absorption and elimination, the final outcome of digestion. And Jaya adhatoda is katu or pungent. And the doshas, which we talked about at the beginning, the tridoshas, the doshas refer to the 3 basic types of constitution. Jaya adhatoda pacifies both kapha and pitta. So that's where that plays in, calms both the kapha and the pitta. All right, let's talk about dosage and preparation. WebMD, we're starting off, WebMD says the appropriate dose of malabar nut depends on several factors such as the user's age, health, and several other conditions. At this time, there's not enough scientific information to determine an appropriate range of doses for the malabar nut. So basically what they're saying is they couldn't determine what it was from the literature, though there are lots of sources on dosing and preparation, which we're going to get into right now. Sodhi says the dose should be 2 to 5 milliliters for a liquid extract. I don't like that because that doesn't tell us the strength of the extract, which I think it really needs to, but that's what it says. 10 to 20 milliliters of leaf or flower juice, 40 to 80 milliliters of root decoction, and 100 milligrams twice per day for 10 to 1 for a 10 to 1 extract. See, that's what we need, is that kind of information to determine proper dosing with that liquid extract earlier. Williamson agrees with these doses, but does not include the dose for the extract. Kumar discusses dosing. The drug Vasaka is often taken in the form of juice extracted from its leaves, mixed with ginger or honey in doses of 15 to 30 milliliters. Leaves can be made into a decoction, or the dried leaves can be given in powder form in doses of 2 grams. Both the decoction and powder are constituents of many preparations used in the Ayurvedic medicine for various affections. It says affections of the respiratory tract. The root and the bark have the same medicinal uses as the leaves. A decoction of the bark is given in 30 to 60 milliliter doses, and the powdered root bark in 0.75 to 2 grams doses. So that's our dosage and to a certain extent preparation. Let's talk about the quality. Don't have a lot to say about it. It was difficult to find anything on what makes good quality Justicia adhatoda. Those articles discussing quality JS adhatoda focused on its chemical constituents, which we will discuss shortly. In other words, what is in it that, and of course, when you start kind of going, this is primary constituents, then more of those constituents generally mean higher quality when it comes from a strictly sort of pharmacological point of view, which really when I'm talking about quality, I'm like, when you're out looking at it, what is good quality versus poor quality? And I couldn't find anything specifically on that. Chinese medical actions of the herb. After an extensive search through several textbooks and Google search terms, I was able to find one source discussing J. adhatoda in Chinese terms, and it was a sales page on the website Made in China. This page says J. adhatoda's Chinese name is Yazui Hua. That's Yazuihua, and is bitter, astringent, and cool, clears heat, cools the blood, and is anti-inflammatory and relieves pain. And indications include blood heat, liver heat, bile heat, polyemia, which I don't know what polyemia means. I just don't. I looked it up and there wasn't anything on the web. So my guess is that was some sort of obscure translation from Chinese. And I don't know what the word actually means. Says Chinese medical actions. Not a great source for these Chinese medical actions, though. What I'm starting to get a little bit more comfortable with is translating some of this stuff into Chinese actions, and this seems pretty good from what I can tell from the Ayurvedic actions and some of the traditional uses of this. I think this is probably a pretty decent approach to the Chinese medical actions. Comparisons and combinations, other than the combination of ginger with this herb, there weren't any other direct comparisons or combinations for this herb in our literature searches. We just didn't see anything. So like to be able to do that, but can't always do it. Contents. So remember that review article by Donkar and their team discusses the phytochemistry of this herb. The chemical compounds found in J. adhatoda plant includes essential oils, fats, resins, sugar, gum, amino acids, proteins, and vitamin C, etc. The phytochemical analysis show that phenols, tannins, alkaloids, anthraquinones, saponins, flavonoids, and reducing sugars were found in the leaves of J. adhatoda. We've talked about a lot of these in some of our little something different in past episodes, so you can always look at those. But the pharmacologically most studied chemical component in J. adhatoda is a bitter quinazoline alkaloid, vasacine. We mentioned that earlier, which the technical name for this is 1,2,3,9 tetrahydropyrrole 2,1-B quinazoline 3-all. And the chemical structure of this is C11H12N2O, which is present in the leaves, roots, and flowers. Besides vasacine, the leaves contain several alkaloids, vacinone, vacinol, adatodyne, adatonine, advacinone, and anisacetine. I put these in to give myself a lot of trouble when I go to read this. Anisacetine and hydroxypegonine, betaine, steroids, and alkanes. Vasacine is metabolized to vacidinone, and analysis of J. adhatoda leaf extract showed that it contained 0.85% vacinine and 0.027% vacinone. The roots also contain alkaloids, vacininol, vacinolone, vacinone, and adatonine, a steroid, docosterol, carbohydrates, and alkanes. In the flowers, triterpenes, alpha amarin, flavonoids, apigenin, astragalin, camphorol, quercetin, vitexin, and alkanes have been found. Okay, done with that word salad. Let's talk about the science here. So Sodhi, who was the author of that book, Ayurvedic Herbs, says J. adhatoda has various pharmacological activities, including anti-tubercular, anti-asthmatic, bronchodilatory, anti-parasitic, anti-allergy, abortifacient, uterotonic, which means it helps the uterus, oh man, I'm totally blanking on the word muscle contract. There we go. It helps the uterus contract. Wound healing, cholagogue, which means that it helps with the bile. And as I get older, these words kind of flit on my mouth. Anti-ulcer, antibacterial, and insecticidal. The exception of some generally poor human research for its use as an abortifacient and uterotonic, these activities are reported by in vitro and animal research. In other words, not a lot of clinical research to support these activities. Chaudhary and their team add expectorant, anti-inflammatory, hepatoprotective, so it helps liver, protects liver, hypoglycemic and anti-diabetic, and anticholinesterase activities from in vitro animal studies. In vitro and animal studies. Oop. Sorry, there we go, we'll go there. Skipped over a thing. So, okay, Chaudhary also discusses several clinical studies showing the following activities: oxytoxic effect with an N equals 24. So an N equals 24 means there are 24 subjects. Helping dyspepsia, N equals 20. Pyorrhea or inflamed gums, N equals 25. And 2 studies treating asthma and bronchitis, one with an N of 24 and another with 32. So the reason why I'm big on putting in the N's is because you need at least 30 to 40 subjects before you can start using population statistics to that study. So anything less than between 30 and 40 patients means that it is not statistically valid. It does not give us useful information for populations. All of these are below that threshold, except for maybe the 32 might be right on the borderline of that threshold. So none of these studies would be what I would call significant. Still think it's nice that we have human studies and clinical studies to show some of these properties, but I don't think these are conclusive in any way, shape, or form. Donkar and their team adds cardiotonic, which means it helps the heart, and antitussive, which means stops coughing, to the list of activities. Okay, let's talk about drug-herb interactions. A literature search did not find any mention of cyclone P450 or P-glycoprotein interactions. The American Herbal Products Association's Botanical Safety Handbook, which is a great book on safety aspects of herbs, does not have an entry for this herb. It's a pretty comprehensive herb, but it doesn't have a lot of Ayurvedic herbs. So it's not, but it has a lot of Chinese herbs, not all of them, but a lot of them. Kumar and their team says adhatoda is considered safe and recommended usage and dosing. Care should be exercised when taking this herb with other drugs or supplements that exhibit expectorant or antispasmodic effects. Sodhi says no adverse effects of using adhatoda in concert with other drugs or medicine have been observed. So I think we can say there aren't at least known drug-herb interactions for this herb particularly. Concerns. According to Sodhi, excessive doses of Vasaka may cause diarrhea and vomiting. This herb should not be used by pregnant women because of its capacity to induce abortion. Kumar and their team says the safety of this herb has not been tested in children, should be avoided unless directed by a medical professional. Use of the supplement is not recommended during pregnancy except at birth, and then only under the direction of a medical practitioner. Chaudhary and their team says usually there are no side effects of J. adhatoda plant when experimented for study purposes. There's no mentioned data of this drug that showed its adverse effects. The only data found is that when it is taken in high dosages, it leads to diarrhea and vomiting. Shankar and their team discuss toxicity in animals and did not find much in the research. They did discuss the administration of Vaseline in humans. Vaseline has been tried in a preliminary human study being conducted for interruption of mid-trimester pregnancy by intra-amniotic instillation of the drug. Doses above 60 milligrams were given in 12 cases, and all of them aborted within about 48 hours. Furthermore, in other studies, it has been shown that Vaseline is a very effective oxytocic agent in human beings in stopping postpartum hemorrhage. So oxytocin is what they're referring to here, which is a normal hormone that is expressed during a lot of things, but especially during childbirth. So it's a positive thing. It is an effective oxytocic agent in human beings. Overall, J. adhatoda appears quite safe when used appropriately and with appropriate dosing. And that is where we're at today. That was another deep dive into herbology. We talked about submarine journey in the first one, so this is a deep dive. There we go. That's the bookends here. And we started our discussion today. We'll look at the similarities and differences between Ayurvedic and Chinese herbal medicine. From there, we did our deep dive into Vasaka, Justicia, adhatoda, malabar nut, an important Ayurvedic herb, and found it can be useful for respiratory and obstetric conditions as well as wounds. While the evidence is pretty light, it has a long history of use and appears to be quite safe. Overall, another fascinating herb needing more studies. We see that a lot when we look at our herbs. In our next episode, we will be exploring another interesting and common Chinese herb, Zhimu, or Anamorena rhizoma, or just Anamorena rhizome. This herb is in the Chinese medical subcategory of herbs that drain fire category under the category of herbs that clear under the category of herbs that clear heat. This is commonly used herb for cooling heat while also generating yin and fluids to moisten dryness. And as usual, we will be exploring something a little different. Please join us for this exciting episode. See you in 2 weeks. Thank you very much. If you like this podcast, please do us a huge favor. Give us a 5-star rating in your favorite podcast app. Thank you. Or just subscribe. Forget the rating. Just subscribe. That'd be awesome. Thank you. And don't forget our amazing continuing education deal at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org/CEUS1, CEUS1. You can also get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. That's SPERBSHERBS.com. So we Americans keep the H silent, while a lot of other, when I was teaching in Australia, they always used to make fun of me when I'd pronounce herbs. They would go, excuse me, doctor, well, I wasn't a doctor, Mr. Sperber, do you mean herbs? And I'm like, no, I mean herbs. And we'd always get into it. So different pronunciations. And I live near the Mexican border where H's are not pronounced at all. So there you go. Thank you very much. And as usual, we have a nice, extensive bibliography. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Thompson.
Dobbins,
Rogers.
Campbell.